I'm going to show you how to start filling patients' details in AccuDent. So I'm going to take a new appointment. I fill the title and the name, Paul, Peter, and the phone number, plus 971 50658 2616. And this is things that they can tell you when you start talking to patients on the phone. We save and we edit an appointment. So the appointment is edited here. We have the appointment. We can open now. And now we go to patient's card. In the patient's card, we have different levels: personal details, referral details, insurance details, communication settings, etc. We are going to talk only about the personal details. On the personal details, whatever you do, whatever you want to change, let me give you an example. I put that, I change something, I want to save now. When I save, there is here a warning. Date of birth is mandatory. This field is required. So you have two options. You know the date of birth because you've been asking the date of birth of the patient for the first time, or you don't know it. If you don't know it, we are going to fill with a fake date of birth, 01/01/2000. And now, if I save, I can save all what I want in the patient's file. Of course, when the patient will come and show up to the clinic, we will update the date of birth because this is a fake date of birth required by NABID. So we have no option to remove that. It's mandatory to fill it. So in the patient's details, you can take a picture and put the picture of the patient here. You can add the title, gender, first name, last name, date of birth, mandatory, and you put a paper file. If you have a paper file, you put the number of the paper file, let's say for this paper file number. So now you have a telephone number, and if this telephone number is the same as the WhatsApp number, which is not the case all the time, you can click on that. WhatsApp number is same as mobile number. I click, and this will populate automatically the WhatsApp number field. Now we are going to put the email, dr.pardieu. I put my email, so we will control what is going on with that, gmail.com. So you put the email of the patient, and then you save. And look at what will happen at this level. At this level, you have been editing an email, but the email that you edited is not validated. You see it's in red around that. So knowing that, what will happen? The patient will receive an email. So I am the patient. I click here. I receive from Dr. Basilis. I receive an email, and I need to click here to validate my email. So the patient will click here, and you explain to the patient, you will receive an email, you will click to validate your email, and you will get email validated successfully. So this is the way to work to validate the email. And now if I refresh the file, I go on that, and I see that my email is validated. If the patient does not do that, you can always, there is a small button here when it's not validated. You can always click on that, and you decide yourself to validate that. So you have the residential address. You have the type of document. Most of the time it's Emirates ID, and we have a module to automatically load that. In our case, we are going to take driving license, and we are going to put a number of the driving license. So state of residence, for example, is Dubai. Nationality, let's say Andorra. Region, European region. And that's it. And you need to link this patient to a practitioner. In this case, the practitioner is Basilis. So you have all, you've been filling all the details, and you can save this. this will allow you communicating with the patient by email, by WhatsApp, or by SMS. So now there is something else that you can do. You can send patient's details. Patient's details are the history, the medical, the chief complaint, the vitals, all that will be filled by the patient. For that, you click here and you say, send by email to the patient. You need to have the email address. You click here and you are asking for that to be sent to the patient. I am the patient. I go back. I go to my emails, and here I receive a new email, and this email, click here to access and update your data. This means that you don't even have to do the data for the patient. They will do it. How? They click on that and they have access to their data. And they can change Paul, Peter. So the name is not Peter, it's Peterson. Okay. Date of birth is not this one. We will put the 21st of 04 of 1907. Okay. So we are going to keep the telephone number. We are going to add the address. The address will be the Palm, Jumeirah. So all this will be implemented now in the patient's file, done by the patient, not by yourself. So when the patient will show up, everything will be done. And they have the chief complaint. So they explain to me they have a broken tooth. Yes, it is on upper front tooth. So you know what the patient is going to request. Okay? So you have all the details, all the questions here. You have a medical questionnaire, and you can change this medical questionnaire to make it smaller or bigger. You have vitals and allergies. So you fill all that with the vitals of the patient, and you have the allergies to drug, to food, to declare any kind of allergy. So when we submit, we are going to submit that, and you will see what happened in the patient's file now. So this is updated. As the practitioner, I received that the patient has been submitting this, and you see now that all the fields are done in a good way. You have Andorra address, Becelis is a practitioner, and you have all the witness and everything. All is there, and I have to update. This was not updated. I have to update the date of birth, and the date of birth is updated in a clear way. Voila. I have been explaining to you how to go to personal details in different way. If you want to have this patient detail module, you need just to buy it. You go to manage account, and in manage account, you have your license. You have the training and support in case you need some training, you need some support, you need to buy some SMS and SMTP. You have all this, but what you have also is the add-ons. And the add-ons, based on what you have in the program, you can do all what you need, but for advanced tools, you can have feedback modules. This is to make statistics and feedback on questions you will ask to your patients to answer, video module, automate patients' details, etc. And all will come here in your yearly or monthly payment, and you have the price of the payment. It's 75 dirhams per person, or 800 per year. That's the way to work. That's the way to work in a good way. When you are in the patient's file, and you are able now to edit in a clear and very simple way all the patient's card. I thank you for your attention.